Hello, I'm Vijay Kumar, the manager at SVT Home Healthcare Services, right here in Nagar, Bangalore. Think of me as your personal consultant for today. We're going to walk through the essentials of home healthcare. Whether you're just starting this journey or, well, just trying to find a better way, the whole point here is to bring you some clarity and, honestly, some confidence.
You know, the journey into home care, it almost always starts with a moment just like this. You see someone you love who used to be so full of life, just not wanting to do anything anymore. And that feeling, that frustration, it's completely overwhelming.
So, does that sound familiar? If it does, please know you are definitely not alone. So many families are going through this exact same thing. Seeing a loved one pull away like that, it's a huge red flag that something's up. The real key here is figuring out what's really going on. That's the only way we can take the right first step.
All right, so let's get right into it. The very first thing we have to do, and this is so important, is figure out what we're actually looking at. Is this apathy or is it depression? Because believe me, getting this right is a game changer. The way you help is completely different depending on the answer.
Okay, take a look at this. It really breaks down the difference. Apathy, that's more about a lack of motivation, right? A lack of interest or effort. But depression, that's a whole other ballgame. We're talking sadness, irritability, feelings of worthlessness. And here's the kicker. The reason this matters so much, you can't treat them the same way. For depression, you might look at therapy or medication. But for apathy, that often needs a totally different playbook. Things like structured daily routines and gentle nudges to get involved. If you mix them up, the care you provide just isn't going to be effective.
And I really have to stress this next point, it is absolutely non-negotiable. If you see a sudden change in behavior, your first stop is always the doctor. Don't just assume it's one of these two things. We have to rule out any other medical issues first, always.
So, once you've talked to the doctor and you've got a better handle on your loved one's needs, what's next? Well, the next big question is about getting the right kind of professional help. And yeah, it can seem a little confusing at first, but it really boils down to two main choices: professional nursing or home caregiving.
To make this really clear, I'm going to use the framework we use right here at SVT Home Healthcare Services. How we separate these levels of care is a really good practical way to understand the choices you're looking at.
This table really lays it all out, doesn't it? It shows the two main paths you can take. And the big question you need to ask yourself is this: are we dealing with medical, clinical needs, or is it more about help with day-to-day life? Because one of those needs a registered nurse, and the other needs a great, compassionate caregiver.
So let's talk about a professional nurse first. The way to think about it is they're bringing hospital-level skills right into your home. We're talking about things that need real clinical expertise: wound care, IVs, monitoring vitals, managing medication, catheter care. This is for when the needs are complex and medical.
Now, a home caregiver, that's a different, but equally vital role. Their focus is all about supporting the activities of daily life. Their job is to make sure your loved one is safe, comfortable, and has help with things like personal hygiene, getting around, preparing meals, and maybe most importantly, just having some companionship.
All right, let's shift gears for a minute. We need to talk about someone who is absolutely central to all of this, but who honestly gets forgotten way too often. And that person is you, the family caregiver. And I need you to hear this. Taking care of yourself isn't a luxury, it's an absolute necessity.
Look, the day in, day out reality of caregiving, it can bring up this whole storm of feelings. Anger, sadness, exhaustion, isolation. It's a heavy toll. And trying to just power through and ignore it, that doesn't just hurt you. It ends up affecting the quality of care you can give to your loved one.
And the numbers on this, they're pretty staggering, actually. Research shows that if you're caring for someone with dementia, you are twice as likely to suffer from depression yourself. I mean, just let that sink in. Twice as likely. So it is so important to be able to spot these warning signs in yourself. Feeling completely drained all the time, crying a lot, getting angry easily, feeling that constant sadness. These are not signs that you're failing or that you're weak. They are alarm bells. They're signals from your body and your mind telling you that something is way out of balance. Okay, so this brings us to the most practical part of our talk today. What can we actually do? Because a home care plan that actually works, one that's sustainable for the long haul, it's not just about the person being cared for. It has to support everyone involved. And yes, that definitely includes you. All right, let's start with your loved one, especially if apathy is what you're seeing. For this, structure is your absolute best friend. So first, try to keep a regular daily schedule. Second, get them involved in small but useful activities. Third, you might have to help them get started on things. And finally, don't be afraid to use little incentives to get some cooperation. Seriously, these simple things can make a huge, huge difference.
And now for you. The steps for you are just as important, just as clear. Number 1, see a mental health professional. It is a sign of strength, not weakness. Number 2, go get a physical exam for yourself, just to make sure there aren't other things contributing to how you feel. And 3, when you do find a professional, make sure it's someone you trust and feel comfortable with. Your own health is the bedrock of this whole situation.
At the end of the day, you have to remember this. You can't pour from an empty cup. It's just not possible. The well-being of the person you're caring for, the stability of the entire situation, it all depends on you taking care of yourself, too.
So, I want to leave you with one final thought, a question to think about. What is the very first step you can take today to support your family's well-being? It doesn't have to be some huge monumental thing. Sometimes the biggest changes start with just one small, deliberate step. What's yours going to be?